she's subconsciously covering her teeth when she smiles. What are we all looking at initially? And that is the old restorations on the front teeth. So she has big composite fillings, class 4s, class 5s, composite on top of composite on top of composite. The second thing we have is a substantial amount of wear and chipping. So you can see it here, here, and all along here. Now, that is more to do with the tooth to tooth position than true grinding and clenching. And as we look at the retracted view, you can start to see how this pattern of fruxing has occurred, or pattern of wear on the teeth has occurred, partially because she grinds and partially because of how her lower jaw comes forward. The lower teeth flare forward, the upper teeth flare forward, and she's just wearing through these incisal edges. Couple things to note. Big cleft here. Options are to graft it or to put the ceramic up to where it is. When you bond ceramic onto cementum, which is what that is, the bond is not as strong, leakage happens quicker, and something that you have to really be careful of. You have to take into consideration the patient's oral hygiene, how well they're really cleaning these areas, and how much enamel we have to bond to in order to secure the restoration. Now, I am not worried with the amount of enamel we have to bond to. I am worried with the amount of recession, the leakage, and the potential fracturing of that area of the ceramic. However, going over this with her, we actually put the veneer right up to where the old recession is. Now, the other thing to look at is the bite. How are we going to get these teeth underneath these? What types of restorations are these two front teeth going to be? In this case, when there's old composites that take up more than, I would say, 60% of the tooth, we're going to take those composites out, place new cores, and prep them for full crowns. These teeth are going to get rolled in. And then the last thing that we have to think about is the actual smile line and what we're going to do with this area here. The smile really needs to be widened past the canine. This canine needs to be tucked in, and these teeth need to come out here and here. Now, she's obviously not smiling as big as she will when she has beautiful teeth. She's subconsciously covering her teeth when she smiles, simply because she doesn't like the way that they look. But up in this region, if we don't do something, those teeth are going to look really thick, because when they put implants in this area, all this bone and tissue was lost. And so you can see the teeth would start all the way up here and come out and look really thick. So we're going to use some pink ceramic here to blend that in to make it look thin. Now, again, looking from the side, you have this flare. This canine is too long. And then these lowers are flared. And if you look at the real shape, you have to be thinking like, this tissue needs to come up. This tissue needs to come up. This we're going to use pink for. This over here, we are going to put the veneer all the way up to the recession. These teeth we're going to roll in. These teeth we're going to crown, so they're going to come out from the tissue and then down so they don't look flared. So they'll have a little height, a little volume of thickness there and there. Same thing with this lateral and this lateral. So we always trial it first in temporaries. So you can start to see this canine gets tucked in. Now you start to see the premolars. It's less of a 6-tooth smile. Same thing here. Canine gets tucked in. Premolars get built out. The front teeth go over the bottom teeth. Top teeth go over the bottom teeth. They get narrowed and rolled in. You can start to see what the occlusion looks like. This was then brought all the way up. This tissue was raised. This tissue was raised. Not because she shows it, but more the volume of the teeth coming out from the tissue has to look correct, and part of that is dependent upon where your zenith is. The last thing, I've made root contour to show them where to put the pink ceramic. And so as the lip goes up and smiles, this will look thin, not thick and over cantilevered. So this is what it looked like with the lips retracted in the final result. Here's pink ceramic, area to clean, canines in, centrals over, upper centrals over the lower centrals, occlusion established, protrusive left and right working were all balanced. You can see here from the side how we were able to get these lower teeth in and these upper teeth out by building the volume out here and then slanting them down so they don't look like they're flaring forward. The final, now you can see a 10, almost 12 tooth smile on both sides, because we again tucked the canines in, took from the distals of the centrals here and here, mesialized the lateral, mesialized the canine, and now distalized the premolars. Same thing on this side, where we mesialized from canine to central, but we distalized the premolars, and that gives you that nice broad smile where she shows a 10, almost 12 tooth smile. Nice color blend, great translucency, overall great success.